Good evening, everybody. I'd like to call the June 21st meeting of the Macon County Health Department Board. Roll call, please.
Mark Scranton.
Here.
Jan Hack.
Here.
Candy Clevenger.
Here.
Jeff Entler.
Here.
Debbie Hill.
Here.
Dr. Britt Jurger.
Here.
Dr. Minigati. Cody Parks. Dr. Jerry Snyder.
Here.
Carolyn Wagner.
Here.
There's Dr. Minigati.
Hi.
Good evening.
Good evening.
Good evening, Doctor. Good to see you.
Good evening. Nice to see you all.
If everyone would please rise for the pledge of allegiance. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Okay, I'd like to get a approval for the agenda topics for tonight, if there's any additions by anybody.
Motion to accept the agenda topics.
Second. Roll call, please.
Mark Scranton.
Yes.
Jan Hack.
Here.
Candy Clevenger. Jeff Entler.
Yes.
Debbie Hill.
Here.
Dr. Britt Jurger.
Yes.
Dr. Minigati.
Yes.
Dr. Jerry Snyder.
Yes.
Carolyn Wagner.
Yes.
Okay, introduction of new board members. Franny, would you like to do that? And then the rest of the room can introduce themselves to those that don't know the two new board members already.
Yeah, thank you. So we're very happy and excited to welcome Carolyn Wagner and Dr. Jerry Snyder to our board. Welcome, and I appreciate the chances that I've already had to meet and chat with you. So thank you for taking the time and thank you for making the commitment to our board. We're really proud to serve this community and we're happy that you wanted to be a part of it. So thank you for being here.
Candy, you want to start off with introducing yourself? We'll go around the room.
Hi, I'm Candy Clevenger. I am the CEO of Heritage Care Health Center, and my private background is in finance. And
She said it's for you.
nice to meet you. Well, I'm Carolyn Wagner. I'm a retired nurse practitioner. I still do some medical things here and there, so I'm pleased to be on the board. My background is public health.
My name is Jeff Entler. I work at Entler Excavating. My background is in business management and construction. And I'm a new guy on the board. Didn't know that?
Dr. Jerry Snyder. I'm a retired emergency room physician. Have been in Decatur, or I was born in the old St. Mary's. That's how long I've been here.
Dr. Britt Jurger, pediatric dentist, so I'm the dentist that's on the board.
I'm Debbie Hill. I'm a board member and I own Debbie Steiner.
Mark Scranton. I own a couple local businesses here in Decatur, and I'm the current vice president of the board. So glad to see everybody here.
I get Minigan team. Excited to see the Decatur Memorial Hospital. Been on the board for quite some time.
All right, then would you like me to have my supervisory staff
I would
come
like,
up?
yeah, introduce staff as well.
If you all would like to just take your turn and come up to the podium so everyone can see you and just start with Brian and work your way down. Oh, yeah, hold on, Brian. I think it's. Unmuted now?
Yes.
Okay, thanks.
Brian Wood, Assistant Director of Environmental Health and Emergency Preparedness.
My name is Vincent Kim. I'm a Director of Dental Division.
My name is Janelle Hockaday, and I'm the Assistant Director at Starting Point. Hi, I'm Marissa Hosier, and I'm the Director of Health Promotion and Public Relations. I don't like to move things because then I mess up. Hi, I'm Rachel Deerwester. I'm the Director of Clinical Nursing Services. I'm Sharice Alenka, and I'm the Chief Financial Officer.
On the runway.
I'm Karen Shiflett, and I'm the Director for WIC and Family Case Management Division.
Hi there, and I'm Bethany Staple, and I'm the Assistant Administrator here at the
Mr. Baggett, you want to introduce yourself?
I'm sorry?
You want to introduce yourself to the room?
Mike Baggett, I'm with the State's Attorney's Office. I'm the lawyer, designated lawyer for the board.
Thanks, everybody. You want to just, they want to stay? It's up to
I
them.
think they are
You guys discussed
mostly
that.
planning to stay, yeah.
Okay, awesome. So do we have any public comments at this time?
I don't think that we do, and we did not receive any via email.
Okay. Hearing none, we'll move on. Motion for approval of previous meeting minutes.
So moved. Second.
Roll call.
Mark Strang,
Yes.
Jan Hatch.
Yes.
Candy Clevenger,
Yes.
Jeff Entler,
Yes.
Debbie Hill,
Yes.
Dr. Brett Sugar,
Yes.
Dr. Minigati,
Yes.
Dr. Jerry Snyder,
Yes.
Carolyn Wagner.
Yes.
Okay, we'll start off with old business nominations for and vote to approve Board of Health elected officers for 2022 to 2023. We have nominations for president, vice president, secretary, treasurer. I knew there's one more there we need to add.
I'd like to nominate Mark Scranton for president.
Second.
Do we want to do these individually, Randy, or as a slate, once we've made motions on each one or not?
I think however you would prefer to do it, or that the board would prefer to do it.
What is the board's
Slate.
preference? Do a slate, we'll go through, okay. So-
If there's more than one, we probably would have to pull them out separate, and then we do have paper ballots available if it did come to where there was more than one.
Okay, nomination for vice
I'm
president.
sorry, Mr. President.
Yes,
Paper ballots, you can't do paper ballots in an open meeting. It's a roll call vote. You can't have, it's not a secret ballot. You can't have any type of secret ballot for elections.
Okay, we need to change our bylaws then.
Yeah, that's something I was hoping to talk about later when it
Okay.
comes up, but you just can't have a secret ballot in an open meeting.
yeah, thanks for pointing that out, Mike. So motion or nomination for vice president.
I nominate Jeff Entler.
I would second that. Nominations for secretary.
Or is it just these that we can delete?
So anybody interested in the secretary position? Does anybody want to be volunteered? Okay, we will do that for now.
Well, I'll just step out and I'll volunteer Carolyn for the secretary position. You can decline.
What is required of the secretary?
I'll let Brandy answer that question, what
Okay.
is detailed in that.
So I'll read you bylaws, and then I'll kind of give you an idea of real life implementation with our secretary position. It says secretary shall have charge of recording and signing along with the president the minutes of all meetings of the board. And it goes into detail about keeping accurate minutes of the meeting, which we actually have an administrative assistant that does handle that. But the secretary and president do sign the minutes after they are approved by the board. And then it states, the secretary shall see that all notices are duly given in accordance with the provision of these bylaws or as required by law. keep a register of the post office address and any available email address of each member, and in general, have all the usual powers and duties incident to the office of secretary of the board, and such other duties as may be assigned by the president of the board. Except where the secretary's signature is required, the secretary may delegate any or all of the above responsibilities to the administrative assistants of the department. And to the point of some of these other things in here, is with a roster, email addresses, our administrative assistant does handle all of that as well. So I would say, unless any other board members have any input, usually it's just that signature on the minutes.
Okay, I would accept
So
that
that,
nomination.
okay, Carolyn accepts that. Do we have a second for Carolyn?
Second.
Who's the
Dr.
first?
Snyder?
You were first.
Yes, Jeff, and then Dr. Stein.
Nomination for treasurer, I would nominate Candy Clevenger just because of her background.
Second.
Do you accept Candy?
Yes.
Thank you. Okay, so we have nominations and approvals. I would like to take a roll call vote on the slate as follows: President Mark Scranton, Vice President Jeff Entler, Secretary Carolyn Wagner, and Treasurer Candy Clevenger.
Mark Scranton,
Yes.
Jan Hack.
Yeah.
Candy Clevenger, Jeff Entler,
Yes.
Debbie Hill,
Yes.
Dr. Brett Sugar,
Yes.
Dr. Menegatti,
Yes.
Dr. Jerry Snyder,
Yes.
Carolyn Wagner.
Yes.
Thank you, everyone. Okay, discussion of committees and role responsibilities. Now, I know that Brandy has provided a handout to everybody of the various committees and the openings that we have right now. We have 3 people on the nominating committee currently. We have 2 openings on the finance committee. So we have 2 vacancies there that we need to fill. The personnel committee is 3 to 4 board members. We currently have 2 openings on that to fill. And then a bylaw committee, which reviews our bylaws and makes recommendations to the board on changes that need to be made. We've got 1 opening on that. So I would like to ask everybody to take a moment to consider if there's something specifically on a committee that you have particular interest in serving on. That's a place to start in my mind. And then if we have some holes still to fill, then we'll take some volunteers. I will tell you, last time Mr. Parks was up here, he got volunteered to committee, so. Finance committee meets to work with the staff on the budget, so that's a pretty important position, to be really in the loop on what's going on with the budget and stuff. The personnel committee is involved with personnel, obviously, and then the bylaws have pretty much went over that. So if there's anybody that's interested in a specific thing to be involved with, let me know now.
I would be interested in being on the personnel.
Okay. So that gives us 3 people on there. So if we get a 4th one to add to that, that would be great. But 3 gets us where we need to be, at least for now.
Mark,
Yes.
could I be on that one and finance?
What's that?
Could I be on that one and finance?
I have no problem with that. So we need 1 person for the bylaw committee, and we need 2 people for the finance committee.
I could do bylaws.
Okay. Thank you, Dr. Snyder. Well, 3 doctors on there doing bylaws. Will that work? 3 lawyers together.
We're on our way to a full house.
Okay, so we've got 2 vacancies to fill on the finance committee. Candy is very knowledgeable about that with her background and stuff, and I think she can definitely chair that committee and lead that group. So
if anybody else is into finance stuff that's interested, that would be great. I would not have a problem doing that unless there's two other people that are interested in doing the finance committee.
I'd echo the same thing. I've got a pretty good background that would allow me to benefit that group, but if there's somebody else that's not on a committee, it'd be nice to see other people from the board that, anybody like numbers, make spreadsheets?
Okay, Jeff, you volunteered yourself. Okay, so we have nominating committee that stands currently is Jan Hack, Dr. Menegatti, Cody Parks. Finance committee is presented now tonight is Mark Scranton, Candy Clevenger, Jeff Entler. Personnel committee, Carolyn Wagner, Candy Clevenger, Jeff Entler, Mark Scranton. And then the bylaws committee, Dr. Menegatti, Dr. Jerger, and Dr. Snyder. So I'd make a motion that we approve these committee nominations. Do I have a second?
Second.
Carolyn, seconded. Jeff, roll call.
Mark Scranton,
Yes.
Jan Hack.
Yep.
Candy Clevenger.
Yes.
Jeff Entler,
Yes.
Debbie Hill,
Yes.
Dr. Jerger,
Yes.
Dr. Menegatti,
Yes.
Dr. Snyder,
Yes.
Carolyn Wagner.
Yes.
Okay, review of the mass policy for board meetings and options. So I'll open this up for discussion. There's been some people that have asked questions about the position of the board in regards to masking policies in light of what other organizations are doing. And I know
had Mike Baggett review everything and have done some back and forth with the contractor, with changes that he made, checking our cyber liability insurance and things like that. And so I'll kind of turn it over to Mike to see if he has input ready for that yet or not. That's the Starting Point Home Meds subcontract.
I'm fine with it. That's all I have to say. There's nothing, there's no legal issues that I see in the contract that are worth discussing. The things that I did see with respect to whether we can be compliant with their cyber liability provision, we did check on that. We are compliant with their cyber liability provision. I made some suggestions with respect to some contract language being modified. They agreed to the language I requested. In terms of the master agreement, I did finally get a copy of that. I reviewed it. I didn't see anything that was cause for concern. It's not my place to recommend approval or not approval. I'm just telling you that from a legal point of view, I'm fine with it.
And I do just want to make you aware, I handed this out to you separately. If you see something that looks like that. If you are to approve this tonight, then the contract would go to EDHW, finance, and then the full. So that it has that cover resolution to put it through those steps if you all approve this this evening.
Any other questions or discussions? Okay,
Do you see this as a win-win?
Absolutely.
Okay.
Yes, we're already doing it and it's another resource and now we're gonna get some reimbursement for it, so definitely.
okay, we have a motion to approve this resolution. Okay, second,
Second.
roll call, please.
Mark Scranton,
Yes.
Jan Hack. Yes. Candy Clevenger.
Yes.
Jeff Etler.
Yes.
Debbie Hill.
Yes.
Dr. Turger.
Yes.
Dr. Menegatti.
Yes.
Dr. Snyder.
Yes.
Carolyn Wagner.
Yes.
Okay, new business. We have representatives from Popeyes here tonight to do a follow to the previous hearing about their desire to reopen their facility here in Decatur.
Hello, how is everyone? I'm Nick Freeman with HC Foods. I'm the Director of Operations. Oh, sorry. Nick Freeman, Director of Operations with HC Foods. Hope you all are having a great evening. Just want to start with introducing myself. I've been with Popeyes for 14 years. Started from the ground up, and I run 22 locations. I manage about 350 people. I took over this market of Illinois in January, and I was made aware of the Decatur location that had been shut down for quite a few health violations. So one of the tasks that I've asked to take on is to get this location reopened. I have 10 stores in Missouri and Arkansas, and I can tell you that I've never been in a board meeting trying to get a location reopened. So this is all new to me. It's not something that I ever deal with. My specialty is operations and team training. So, that's one of the things I pride myself on in the company. I've been the #1. When I was the district manager, I was the #1 in the whole company. They have almost 450 locations, I believe now. So this isn't something, running a restaurant isn't new to me. So this is a challenge I'm willing to accept if y'all give us the opportunity to reopen. What I do know is there were, looks like 26 visits from the health department. They had issues with sanitation, plumbing issues, not keeping the store clean. Looks like my records show that there was a walk-in cooler that had went down, and some type of pest infestation. So looking at the history of it, what I would say is first and foremost, we do now have a training department that focuses on making sure the staff understands the importance of cleaning and health, and making sure that we have the serve safes in place, and I know they have the allergen training that some counties recommend now or require, so we also do those. We do also have a maintenance structure that's in place now that wasn't in place before. So basically I have an app on my phone now, so if a walk-in cooler goes down or an AC, I can sit there and plug it in and it goes to whoever the vendor is, and they come out within 24 hours, depending on if it's an emergency situation or not. So that's something that we put in place that would, at that time, prevented a lot of the things that happened, if that makes sense. One of the things that talked to the owner about, and the VP that's here with me over the Midwest, is they're willing to put in over $100,000 into reimaging this location with new equipment, new fryers, refrigeration, painting the building inside and out, new lobby, chairs, so it basically had like a grand reopening, if you will. Let's see, we have a whole new team. Obviously, I'm new to this because I'm the only director in 4 states. He has the Midwest, I believe, what, 143 stores?
Close to 160.
160, so he's getting more as we go. And then I have a team of 6 district managers that help me manage 4 different states. So I would like to say that I did hear about this location, and after talking with the owner and the head of operations, it was, a big black eye for us, and obviously, after I drove by the store here, I know it doesn't look good sitting here in Decatur. It's overgrown. I actually got with a landscaper to get some quotes to get it all cleaned up. But I would ask that if y'all would let us reopen the location, and with our new team and all the new things we have, and to not make it an eyesore that's here in town or something that's
Good evening. First and foremost, congratulations, Mr. Stratton, your appointment as president. My name is Mir Ali, and I'm the vice president of operations for the HC Groups. We are the largest QSR company in the United States. We just don't have Popeyes. We're based out of Houston. We have Wendy's, Taco Bell's, Burger King's. We have a portfolio of almost 4,500 almost restaurants total. So we're not new to the QSR industry. My role in the Midwest as the VP of Ops, I just took about 6 months ago. So this situation is very unique to myself. And obviously it's very important for our business and for this community as well. So we understand, we take ownership of what's happened in the past. And shame on us. I mean, I take full responsibility on behalf of the company. And I truly researched quite a bit on the store, the Facebook posts, and people just talking about Popeyes. And we've learned a big lesson, as a company. For 3 years, we've suffered, financially, where we're paying property taxes and our location's been closed. We've obviously had the wrong pieces in their places, if you will. But we've done a complete overhaul in the Midwest in general, including my new job role here, Nick Freeman, one of our fantastic, director of operations. I lead a team of 9 director of operations all throughout the Midwest, encompassing about 160 locations. And like I said, this situation here is very unique to me. We do take a lot of pride in our food safety. Unfortunately, what's happened in the past, we are committed to food safety, because if we can't keep our people safe and our restaurants safe and our food safe, this should happen to us. But Decatur's been a very hot topic in our corporate office. The word, hey, I'm gonna, shut you down like Decatur. We hear it all the time. And I think we've learned a big lesson, like I said. And we're asking for your cooperation. And we do want to give back to the community. And every community we function in, Milwaukee, I'll tell you one thing, we had the same situation in Milwaukee, not shut down for 3 years, but the remediations were not being followed up on. The health inspectors, they'll come in once, they'll come in twice, they'll come in 3 times and tell you, hey, you guys got to fix this, you guys have to fix this. And it wasn't being done. So I personally went there, built a relationship with them, and we remediated all the issues, especially when it comes to food safety. So like Nick alluded to, we've rolled out a dedicated training team to train all our new staff, which was not in place before, the new maintenance program we have in place, and truly the re-imaging that we're gonna do with this building. And I brought some specs up here for you guys. We're really gonna put a nice Taj Mahal up in Decatur. And it's upwards of almost $500,000 that's gonna cost us with nice brick fascia. It's really gonna, I felt really embarrassed. I came here from Chicago and I was driving down the road right before I made the right into the street to get in here. I looked, I'm like, oh, that's our Popeyes, looks like a jungle. It really does, and none of our stores look like that. And at this point, we're here in front of you pleading for your cooperation, your blessings as a board, and allow us to be a part of this community once again. And we won't let you down this time. I will personally leave my card here if there's any issues, and I know Nick does a phenomenal job with hiring, with staffing, when we want to give back to the community. Every community we're in, we want to hire from the community, plus it's economic development. We do generate sales tax dollars. And given the fact that the KFC's closed, I think the people of Decatur have been longing for some good chicken, and we've got the best. So with that being said, I'm here to entertain any questions, which I'm sure you guys do have. I want this to be a, two-way conversation and reciprocation, if you will. But I'll entertain any questions you have. Take your jabs. I'm ready for it. I came prepared.
Are you gonna bring your management to the restaurant?
Yes. This is gonna be all new staff. We're gonna hire from the community. We have a full training department. Nick is the director of operations, and we have different district managers in Central Illinois. I just came from 2 locations in Bloomington. We have 2 in Springfield, Champaign, in Central Illinois area, all the way up to Iowa, Davenport, Fox Cities. So yes, we will have a full training crew on hand. Nick himself is going to be involved because this is a big priority for us. And we're getting our hands slapped by the brand as well because they're finding us on royalties from 3 years ago. Like, hey, it's not our fault that you guys shut down. You guys told, you're still going to pay us royalties for whatever you were making. And it doesn't make us look good, and this is the only location we have in our company that this has happened to. So we're embarrassed about it, and we want to do something about it, and we want to make it right. And that's one of the reasons why we're here, to make it right. Yes, doctor?
I don't recall the exact timeline when this happened and when it was shut down. But let me ask you, why did it take this long for you to get your attention to this particular?
I'm going to tell you right now what happened. We bought the store in 2017, our company. We bought it in 2017, and shame on us for buying it blindly. And I'm going to be very honest with you. Our company's so big. The owner of the company, CEOs, they look at numbers. They're numbers guys. So as soon as we bought this store, within 45 days, it already had a pre-existing condition in medical terms. So as soon as we bought it, we were kind of thrown off guard with the infestation right away. And then all the equipment started breaking down on us. So yes, the reason why it took us so long, 3 years to come back, because we wanted to make sure that we fixed the Midwest, we fixed the culture and the operations team here. It took us some time because we were struggling in different stores, not being shut down, but with just leadership. So it took us, we restructured, they brought me in about 6 months ago as a VP. And then, I was just going through, through my list to see, but this was my first priority. Once I got to know my team, we had to build a new team because Quad Cities, this area in Central Illinois, is away from Chicago where I'm steps in, away from the office. I got a huge team out there. So we really needed to get that team intact. So for 3 years, what we've been doing is we put this area on a plan. We have a lot of development happening in the Southern Illinois, Central Illinois, Western Illinois area. And we had to come up with a plan because the company just can't be, dishing out millions and millions of dollars, building new locations and having these same, problems going forward. So we really took the time to attack the problem at the root level. And as you can see, rolling out an entire training team for the entire company. It just wasn't specific for my division, the Midwest. It was for the entire company, for our Southern division, our Western division, hundreds of stores. So yes, it does take some time, And that's one of the reasons why. And plus, I didn't want to come here and do the singing and dancing and, not live up to the word that I'm giving you guys today. That's the worst thing we can do because it could happen again. And we really wanted to take the measures to make sure that we have this thing down packed and these mistakes will not be repeated again. So I hope I answered your question, Doctor.
I guess my concern I've got, and I looked at what's happened here with the Decatur store in the past, that you guys are so big, can you truly have hands-on management where you can really take care of business? And the reason I ask these questions is because we've got inspection reports from several of your other locations around here in Central Illinois. Here's the one from Champaign, improper hot and cold holding of foods, toxic stored over food, hand sink being used for other uses. That's your store in Champaign. The other store. So sanitation observed 3-compartment sink, incorrect levels, no hot water, hand sink, improper holding of food products, flies, single service items being stored on the floor, multiple surfaces soiled. I mean, I've got like 6 different reports, and as a result of this action on this one particular one, you guys ended up getting closed, and you're saying you guys have never been closed down before.
Not to my knowledge. I've been in.
Well, I'm
here
saying you
6
need to look
months.
at these reports
Yeah.
because this is from your stores.
Understood.
That you guys are overseeing. Hand sink with no soap, no towels, hand sink not accessible, improper thawing, single-use items improperly stored, prep sink had a hole in it, multiple surfaces soiled, no garbage cans provided for hand sinks. So you got some issues here at your other stores. So I guess my question to you is, if you've had these issues, and this is just over the last year, these are fairly recent reports that have been done. Why should we accept that you're gonna come in here and change the store in Decatur when you've got stores that are currently in operation that have a record of having some issues? And I guess what you're gonna do to change my mind, and not that I'm against you guys reopening. The gentleman that was here before, I will tell you, spoke very, very well. He spoke about his ties to Decatur, the fact that we're sitting on ground right now in this building that belonged to his family. So I could see the passion and the drive behind what he was saying and everything, but then I see this stuff and it's like, okay, are you guys really at the task of taking this on and reopening this again? And I appreciate the fact as a small business person myself that you guys are willing to make a significant investment to get this place back up and running again, but this facility's already had a bite at the apple twice before, and in my mind, failed pretty badly. So I guess I'm looking at, do we give you guys the opportunity to pursue this a 3rd time now?
Absolutely, and those are all valid questions, Mr. President, that you brought up. That is one of the reasons why that I mentioned that we rolled out a full training program for food safety and a maintenance team. We have our own maintenance crew that works in the more dense areas, in the metropolitan areas like Chicago, Houston, where they're 2 minutes away. So what we did was to address the sinks that you're mentioning, the faucet's not working. These things do add up to food safety. So we took the measures and we rolled out this program called Met Facilities, which Nick alluded to a little bit ago, where the managers, I know I can't send my maintenance team where I have 4 guys that are on our payroll sitting in Chicago and they're, hop, skip and a jump away. So we went the extra mile because we knew these gaps that were existing. And our managers have to have that resource when they just get on the app, they put it in, the vendor gets dispatched, and boom, they're right into your store. So that's number one, and that was very critical, or else I would not be here investing, the company's $500,000.
How recently did you start that?
This just happened a few months, almost less than 6 months ago.
Yeah.
The Net Facilities, it was a pilot program that we used in different areas to make sure that it works, and we just started that out here. I was just in Bloomington, finding landscapers is tough because we only have a few locations here. So those are challenges that we still continue to do. But as far as food safety goes and the training goes, we're revamping a lot of these stores now. That's why we've got Macon to place, and more in Arkansas, even Davenport and Moline. You mentioned the Champaign stores. I just visited the same DM that has the 2 stores in Bloomington. And very driven guy, but we really need to work with these people and give them the resources, because he's like, hey, before we were not even, who do I call? Ghostbusters? I can't make that call. When we call, I'm calling local vendors. As a company, we never gave them the resources, and that's why we have dedicated those resources to these people. So they have a resource, they have somebody to call on. So yes, we do understand we have opportunities, and we are working with those day to day. But I assure you, I'd probably be out of a job, as you alluded to, $500,000, $500,000 is a lot of money. But we are committed to this. Are we perfect right now? No, we're not. But we're much, much better than where we were a few years ago. And that's how I measure progress. And we've had issues with, hot water going out, maybe 60 seconds. Our audits we've passed with the brand. Because sometimes, hot water, the rule of law is if it's not 100 degrees for your hand washing sink, within 60 seconds, they shut you down. That's happened to me in city of Chicago. But city of Chicago, I also understand, is all about making money. Your mouth, if your nostrils are showing, they write you a $500 ticket. They have quotas. But we appreciate the community, and we've really missed being here, from what I understand. And I think it would be, it almost feels like a disservice to the community. So we're really just asking for your blessings to allow us to do this. And if we fail, we fail. And it's a big, big loss that, we're going to take. But we're willing to do everything on our end, and we're willing to reinvest into the community. And you hold us to it. We're not going to drop the ball. And if we drop the ball, we have, myself included, and Nick, very high consequences, to pay. So if I'm willing to put my job at risk and the company's $500,000 to come here, we have a plan in place, and we're looking to execute that plan to the best of our ability.
Do you guys own any of the Wendy's or Taco Bells around here,
No,
since you made reference to that?
No, sir.
Okay.
We do have Taco
Any
Bells.
other non-Popeye restaurants
We
in the area?
we have some Taco Bells a little bit west of here. We do have some Burger Kings north of here. It's a little south of Chicago, between like Joliet, Kankakee, those areas. We have tons of Popeyes, obviously, in the Chicago area. South of here, more Missouri, Arkansas, St. Louis area, we do have some. Houston, we have tons. We have La Madeleine's, we have Wendy's, we have Taco Bell's, obviously Burger King's. They're all part of the RBI brand. Restaurants Brand International, which is the parent company, for Popeyes, Burger King, and Tim Hortons.
Carolyn?
Yes,
ma'am.
Besides what you stated, not having dedicated maintenance people for your managers to be able to call, you saw that as a big downfall and why you had such a problem. Was there anything else that you saw? Did you have problems with stable staff? Did you have problems with your leadership? Can you pinpoint anything else that went wrong?
Yes, I will, and that's a great point, ma'am, that you brought up. I personally was not here, through this whole, since 2017, this has been going on. But I will tell you, the leadership, we've completely, yes, we did have the wrong leadership, and they're all gone. From the restaurant managers to the crew, obviously, from the director, from the district managers, all of them. We brought a brand new team, including myself as a vice president. So yes, the team has been replaced. Also, as far as training, now we've rolled out that we have centralized training, where before we had a process in place. Don't get me wrong, Popeyes is a brand. They have to protect their own brand as well. So there has been a process in place. The process was not being followed. The food safety standards, the HACCP logs, it just was not being followed. And we had to hold ourselves accountable, and the leadership that was here, but the VP was never involved, not following the process on how you guys are doing, what's going on in the business, how are your training metrics, did these people go through ServSafe training? The processes were not being followed. And we learned a big lesson from that, as a company, or especially, I shouldn't say the whole company, what was going on in this part of the world, especially central Illinois. Because the VP previously, they're just focused on the big markets, and they treat these stores like they're stepchildren. It'll happen, but you know what? No, that's not the right way to do things, and we realize that. And to answer your question, yes.
Any other questions, discussion?
Would it be possible for you to look at the local markets and the data that we have and give us a little bit of a response as to the problem areas in Bloomington, Springfield? I don't think we had access to Champaign directly, did we? But would you be able to respond to those? Because that seems to be the question that I think all of us have at hand is the data that we were able to look at and see, and it just didn't feel good.
Yes, correct. You're seeing the red flags pop up here and there, yes. We just replaced the district manager. So Jamil, he's our new district manager who's he will be overseeing this store, and I'm more than willing to bring him, to introduce him as well. He's a great guy, and he's been with us, almost a dozen years?
Almost 11 or 12 years.
11 or 12 years. So we relocated him to take over this market, along with Nick. So we kind of restructured, bringing our best players closer to central Illinois. We've moved him here to watch over these stores. And this was just recent because, as I was looking at the geographical area here, I'm like, okay, well, if we spend all this money, we fix everything, and money is not always the solution. You could throw a lot of money at a problem, but if you're not fixing the behaviors, the bad habits come back. So we really want to make sure that we put the right players in their place, and now we have that. And now what we're doing is staffing. Staffing has been a sore subject everywhere. We rolled out WorkStream to assist our people. Before we were using platforms like Talent Reef, where yes, people are applying, but half of them are applying just to get their unemployment credits. Well, yeah, I applied for a job, here you go, copy my check. So WorkStream, we took, the pressure off our teams also. And I'm all about that, giving resources to our people at the ground, because these people have been through a lot, restaurant general managers. And I don't take that very lightly because they're still here, irrespective of working shorthanded, not having enough people, they still kept our restaurants open. And I am huge on that behavior, promoting a positive environment. We rolled out WorkStream, which is a recruiting platform, because we know that, hey, we're spanking their hands saying, hey, you're not hiring, I'd see 5,000 applicants in Talent Reef. They don't have time to hire. They don't have time to go on the computer, a general manager. They're, just trying to keep your restaurant open. So we hired WorkStream, we rolled that out. What it does is you apply, it texts the person, schedules the interview, they walk in your door with their documentation, hire me. So that is helping a lot. We're screening employees, and the training that we're rolling out, the people that are coming into our stores now, and that's a process that was not being followed, is number one, your first 4 days is all about food safety. Our Foundations 1 and Foundations 2 program, day 1, 4 hours. And then we're taking an extra step forward. We're bringing our training managers here. We do centralized training now for this market. So we're not punting off, our new hires to develop bad habits, which may already exist in stores. So we're bringing our training manager here, doing centralized training. And Decatur being, ironically so, right in the middle of Champaign here and Bloomington, it's a perfect location. And it's a perfect store to have that centralized training. So our training manager will come down, we hire the people, that's the process we're putting in place. She trains them here on food safety and all the company standards that we have. That's a 4-day class that they will take, and then they will get dispersed off, to their locations where they will be working. So that's something that is very important to us. And like I said, we can't be doing the same thing over and over again, expecting different results. That's insanity. So we had to do something. Yes, ma'am.
So you're saying that Decatur, if allowed to reopen, would be essentially a training hub?
It would be.
For all of this?
It would be, for all of central Illinois.
So constantly you would have training going on?
Correct.
Okay.
And also, we have we're held accountable as franchisees to have a certified training store in each market. There has to be one. And this market has never had one. And our hopes are with, the new re-imaging of the store, we're putting in new flooring, new equipment, new walk-in cooler. We're doing a lot of, the dining rooms and the outside. I mean, it's gonna be brand spanking new. And we wanna make a big boom out of it, and we wanna get the store certified. And in order for the brand Popeyes to certify that store, you have to abide by a lot of operational metrics. And our stair tech audits are 3 of them a year, they're unannounced. You must score in the 90th percentile in order to be a certified store. And that is, so if you look at the big picture, that's what I'm trying to get to, that this is a very important store for us. That's why we're willing to put the money into it, the resources into it. And I know I'm not going anywhere because I've been put on a task, the Midwest as in general, as a whole, to plug these gaps in and go out to these areas where our stores are struggling and fix the problems, close the gaps and support our people on the ground.
I'd like to add something to your
Yes, ma'am.
question. So I started out in Missouri, Arkansas, and that's where I grew up from, and they brought me up here to take over. I would say, and he can correct me if I'm wrong, most of our markets across the nation may have 1 or 2 training stores in the area. One of my personal goals was to have all of my stores as training stores. So out of the 10 that I have there, 6 are certified training stores. Is not necessary, but that's the standard I wanted to have, so.
Knowing what you know or should know about this market right now, how many people are you gonna have to hire to make that store viable to operate?
At least 25,
Wow.
minimum 25.
Is that big?
Pardon me?
Is it that big there?
There's no KFC in town, so I'm hoping it's gonna be busier.
25 actually sounds like a small amount to me.
Yeah, it does. Well, we end up with 25. What happens is, in my experience, anytime you open, and we're gonna treat this like a brand new store opening. So you start off with about 60 people that you hire, because that grand opening week, and then, the store settles down in sales. But when you start, you gotta have the staff available to work that store. If not, then you give me 1 chance, give me 2 chances, you're waiting in the drive-thru for 30 minutes. Like, you know what, I'm not coming back, because it's the norm now. So yes, to answer your question, we start off with a much bigger chunk, with about 60 or so. And then, it trickles down. Some of them stay, you have retention, we try to retain as many as we possibly can. The part-timers, the kids, they play a huge role in our business. And I tell my team the entire time, these kids, some managers, I've made a policy, you cannot, the GM at the location, they can't fire anybody. They are not allowed to fire anybody unless it was theft or some very, very bad behavior. They have to do their due diligence. You have to work with our kids. If a kid's got a date with his girlfriend and he calls off on a Friday night and the manager says, hey, you're fired. I made it a rule of law. And I've also told them you have to hire from the community. Your stores must reflect your neighborhoods. There's no such thing as an all African-American store, Caucasian store, or, Hispanic store. You look at your community, you hire from the community. And we've been very successful rolling this out. The 6 months I've been here, I myself, I'm the chairman of the Plan Commission in Bolingbrook, Illinois, just north of Joliet, south of Chicago. So I understand municipal responsibility. I understand, I'm a Rotarian, I'm part of the Lions Club, BYBL, I was a coach for baseball. So I understand that we have to give back, these are our customers. So that's the culture we're really trying to bring here and elsewhere in these markets but it's work in progress because there's barriers, there's bad behaviors. People are used to one thing and I'm really trying to change that culture. As a company, we are. So yes, that's something that's very important to me. But as far as staffing goes, we don't know. The store at one point, was doing $35,000 a week. When we had first, we look at the numbers, but when this happened, we're barely doing 10,000, rightfully so. We couldn't even pay, our taxes and, our bills with that. So the idea is we have our projections in place. We're gonna clean the place up, we're gonna make it look nice, And we're really hoping that it gets back to that volume or even more. And we have our ideal staffing guide is, normally in the QSR industry, it's one person for $1,200 or so you make. We've gone down to 1,000. I'm like, if they're making 35,000 a week, you should have 35 people on the clock. Or, higher than that store. Out of which about 15 are your full-timers, the next 20, 25 are your kids. So don't run short, schedule 6 of them, 3 of them call off, you still got 3. It's okay, and we have to work with that. So yes, to answer your question, that's the number we're probably looking at. If the store is doing about 35,000, we're looking at about 30 to 35 people. And we want to staff from the community.
I guess my concern, to enlighten you a little bit, I'm a small business owner, Debbie's a small business owner, Jeff's a small business owner. That's at least 3 of us here in the room right now.
Yes, sir.
Every business, but more importantly, small business, when I say small business, I'm talking about small from an employment standpoint, all the way up to the larger corporations. Everybody, everywhere is experiencing just unprecedented challenges in trying to find people to hire. I appreciate the fact you guys are coming here and invest maybe $500,000, but the reality of it is, are you gonna be able to find the people to staff this thing, to run it properly? Because every business that's here right now is barely hanging on by a thread, especially when you get into the restaurant and bar business, that they just can't find the people, they can't keep the people. So I'd be really curious to see how you guys are gonna make this work in terms of getting people to come to work for you. Because I can tell you from my own personal experience, I got 25 people work for me. And it doesn't matter how much money you put in front of people, if they make up their mind that they don't wanna work, or they wanna go someplace else that pays them a little bit more money, whatever the reasons are, they're gone. And employee retention is a really, really big problem right now. And I'm not just here in Decatur, Macon County, but everywhere I travel, I have a lot of businesses with people that are all over the country, and everybody has got the same issue. So I appreciate that you want to come back and reinvest in Decatur, but I would tell you that finding employees is going to be a real challenge, I would think. And I hope that's something you guys have really researched thoroughly.
And you know what? Yes, you're absolutely right. I couldn't agree with you more. This is a challenge that we've been dealing with all along. We still have stores, you don't have people to open up dining rooms. You can't do this, you can't. So it's just not a Decatur problem. This is a systemic problem in this country right now. We've tried, I just drove by Taco Bell. They had a sign saying, hey, starting at $15 an hour. Well, imagine what's happening to my Chicago market where minimum wage is $15. I have to start at $20 an hour. So we'd rather have our doors open than closed. If we have to pay more, we pay more. As business owners and leaders, we have to do what we have to do to keep our doors open, because they're better open than closed. So the number 2 thing is the work environment. If a person comes to work and they're frustrated, they're not gonna come back. And that's something we found out. That's why we rolled out this new training program that the first week, they don't do anything. They come through their training, get trained, you don't push them into position, you're already frustrated, keep that person in a bubble, keep them protected. Give them the free meal, give them that 15-minute break. Because what was happening in the past, these people, influx of applicants were coming in. But the first day, hey, can you go season that chicken? How do I do that? So training, that's why, is very, very important in this role. And the person that sticks with this job, and we've seen with the data that we have, 1 week, if we can hang on to them for that 1 week to 10 days, they're gonna stick around. Because the people that were walking out the first day, they don't come back the second day. That's exactly what was happening. And we were proactive. We saw this happening, the train crash coming in. So we thought, no, we got to shift gears here. Now we're investing thousands and thousands of dollars in this new work stream program where people are walking in our door, but now it's like a revolving door again. So then we sat down and collectively we decided this was the gap, and we're addressing that. So yes, are we going to be challenged? Possibly, but we will try everything within our control to retain our staff, whether we have to pay them more. And this is where I go to communities, I go to the Chamber of Commerce, I go to the community organizations. Like, hey, we want to hire from the community. I'm looking for a general manager. If you know somebody looking for a job, please help me out. We'll pay top dollar.
So when you open and you have someone come to project, and which is a very touchy thing.
Yes, yes.
Will you have, some of your people there?
Oh, yeah, yes. We have a new restaurant opening team. I forgot to mention that. So this team, they're dedicated to me, my division, the Midwest. So every time we open up a restaurant, we have the best general manager, our training leader, the new restaurant opening team. They are in that restaurant for a minimum of 30 days. And they are there before. While the restaurant is getting built, that restaurant team works along with Nick. And what they do is they do the staffing. It's not like, we have a process in place that we start 3 months before our, grand opening day, or when the day we open up our doors. So they come in, they start staffing, they start training, and then we have our other team that complements them, which are already trained. So the day we open up our doors, we're firing up on all cylinders. So it should be a pretty smooth transition. It has been working. We just opened up a restaurant in Gurnee, Illinois. We opened that one up. In Lockport, Illinois, we opened that one up. Oswego, we have another brand new one opening up in Berwyn, Illinois. So yes, it has been working really well. And we've been able to retain over 70% of the people so far.
Okay, anybody else have any questions for these gentlemen at this point in time? Okay, I would like to ask Brian if he would like to offer any feedback to us on what we've discussed so far.
I haven't read the research that Kathy and I did on all our previous history and the other local facilities for a while. It's been a while since I've reviewed it, but it's a large corporation. They've had too many chickens to watch over. The team here has presented a good case for they have solved those issues corporately. Locally, it sounds like they haven't caught up with their plans yet, but there's hope. But based on our neighbors' franchises that they operate, I can't look at the history of how they have improved over the past 2 or 3 years. Recently, they've still got challenges like any other food facility, but they have presented a plan that sounds logical and reasonable that addresses those issues that we have commonly seen, not only in our facility, but in neighboring facilities that they own.
So I guess my question to you, Brian, speaking on behalf of your division, do you have any objections if they choose to try to reapply to reopen the store again at this point?
The main challenge that we would feel, we do have a limited staff, which we're running at full steam. We're able to do our work, keep up with it, do it well. But as 2 other facilities we have in town, one that reopened under specific conditions because of its past history, it is very time consuming to do the extra steps to watch over because of the complexity of the additional parameters we're watching. So this facility would also be time consuming because we would have to watch over those extra parameters and probably impose some other restrictions that we can monitor continuously for the opening period. So that would be our biggest challenge would be time.
And if I may, just interrupt, I didn't mean to. We're looking for your blessings at this point. We're still ways out from opening. So things may change with your resources, the staff, and I personally and Nick will work hand in hand. He'll be your go-to person and along with the district manager, whatever visits, however often you guys want to do those, scheduled or non-scheduled. So that way we want to build a relationship again with the health department as well. But we're just looking for your blessings today. But mind you, getting new fryers is taking you 12 months right now because of the parts and the walk-in coolers. I mean, the air conditioner, I was just in the store and it's like we can't get a part for an air conditioner. So it's all contingent upon how soon we can get all the equipment and stuff. All we're asking for is for you to give us your blessings so we can go ahead and start making these investments and put in our plans with the city so they can approve them. But as far as opening goes, I don't see, realistically, not happening for another year, maybe 9 months down the road or so. But we want the health department to be involved, if there's any drain issues. We're gonna have them jetted, have them, if there's any broken pipes, whatever we have to do to get this thing to be top notch, we're gonna do it. But once again, we're not gonna come in here tomorrow, put some paint on it and try to open our doors. No. We're just asking for your blessing so we can go ahead and make this investment with the hopes, knowing that, we're gonna be allowed to hold it. Sorry.
Okay.
And I don't know if Brandy and Kathy had other discussions, pardon me, that I didn't hear. But those are things I know about it. If Brandy has some other things, Kathy, what do you want to bring up?
What I have from Kathy just kind of supports exactly what Brian said, which is the additional staff time that would go into enforcing any additional stipulations. And for our new board members, just to give you background, we've had total 2 in history that Kathy and I have been here, which is 18 and 16 years, 2 permits that have been revoked, Popeyes and then 1 other. And with the other one, they were allowed to apply for a permit again after being revoked, but they were required to have additional stipulations put in place above and beyond what other food establishments in that category were required to do. So that was just to give you a couple examples, and there were several things, but additional temp logs that had to be turned in weekly, additional inspections to ensure that everything was being followed adequately. I mean, there were several things. And so then that does add on to our team. The leadership staff, Kathy and Brian, have to review those things that come in every week. If they do find that there's an issue, which in the other situation, there have been issues that have continued that have had to be remediated. And so that takes time. And then the additional inspections take time from the staff. So that was one of Kathy's points that she just wanted me to bring to you tonight since she wasn't able to be here. Just the concerns about that and the concerns about the surrounding food establishments in other areas that are owned by the same company. I also mirror her concerns about staff time, but I also want to ensure that we are being consistent, that we are supporting businesses where appropriate. Ultimately, it's up to the board, and we would have to figure out staffing wise and what those stipulations would be, how we would actually realistically implement that if the board allowed it. And I will tell you, the board did give discretion to Kathy Wade and Brian Wood, the leadership of environmental health, to develop the stipulations that were appropriate based on why the facility was closed in the first place. And that's all that I really have in addition to what you shared. Thank you, Brian.
Any other discussion? So I would like to make a motion then that we grant them the ability to reapply. And it's basically, I'll be honest with you, based on the commitments you've made tonight, both in your plans for your training and the investment, because $500,000 is not a small amount of money to drop into a business.
We understand that.
Nowadays. So I'm gonna make a motion that we give you guys the opportunity to pursue reapplying again with the stipulation that you will be agreeable to reasonable stipulations that the environmental department may put in place per what you guys are doing and certain things that they deem appropriate actions along the way, because you are talking about something that's gonna take quite a bit of time. And I think, Brian, wouldn't you agree that we got a long span of time here to work with these guys to have those conversations and say, this is what we're expecting from you, and get them to perform clear up until the point, because you may say, hey, you guys spent a bunch of money, that's great, but you're not doing the other things that we asked you to do, so we're not gonna let you guys open until we have something a little bit more solid here.
And with the kind of lead time he expressed, that would probably give us enough time at each step to fully evaluate.
Right, and that's what I think makes the most sense. So that's a motion I would make.
I'll second the motion.
Any other discussion? Roll call.
Mark Scranton,
Yes.
Jan Hack.
Yeah.
Andy Clevenger.
Yes.
Jeff Entler.
Yes.
Debbie Hill,
Yes.
Dr. Jerger,
Yes.
Dr. Meningati,
Yes.
Dr. Snyder,
Yes.
Carolyn Wagner.
Yes.
Thank you, thank you.
Thank you.
You won't be disappointed. Thank you very much.
And we need it for our chicken.
Okay, review of Board of Health bylaws. Brandy, do you have some specific on this that you want to speak about?
I'm gonna turn this microphone off really quick.
Okay,
So in the bylaws, it states that every June, the board will review the bylaws. Earlier tonight, it was determined that we do need to change that paper ballot part. And we always send Mike the bylaws each year, so he does have those. So what I can do is if he has any additional recommended changes other than the paper ballots, I can bring that back to you after I hear from Mike and give you the ability to, request any additional edits or approve those at that time. And if you have any requested edits right now, we can certainly discuss that to make that, part of the process right now, kind of on the front end.
I'd request, since we have some new board members and we just kind of seated our committees tonight, that the bylaws committee take a look at the bylaws along with the rest of the board, and that the bylaw committee and anybody else has any recommendations, changes or additions that they'd like to submit those in writing to Brandy prior to next month's board meeting, and then we can have a little bit further discussion on that in the interest of time. And this does take a little time to read through, that we're not rushing this to get this completed, so. Okay, communication, board education, COVID update.
Okay, so just a few updates for you specific to COVID. Numbers have remained a little bit higher. We've been talking for several months now about the uptick. We are currently in medium community level, and then that is the number that is used for community members to make decisions on precautions to take. And then we are currently in high community transmission level, and those are the levels that are provided for healthcare facility use only. Numbers, total cases, we've had a 3.93% increase in the last 7 days. And as of June 16th, our case rate per 100,000 is 312.47. Last month at our board meeting, it was 192.29. So it's gone up quite a bit since then. Testing positivity as of June 14th was down 1.76% in the previous 7 days. And then hospitalizations through June 15th, there's a 40% increase in new admissions in the last 7 days. Last month, it was down 12.5%. And that's all pulled from the CDC COVID tracker website that we talked about earlier. The changes with the surge center that we've been talking about have been implemented as of June 1st. So for the most part, not completely, but there aren't the contact tracing calls and the calls to close contacts and all of that was going on, for 2 years. We as a health department are still working any outbreaks or clusters or anything, just as we would with any of the other communicable diseases that we follow up on. So that's still all going on. And then I did reference major staff changes in my board report, but just in case anyone missed that, I did want to make sure you all knew those PRN or as needed contact tracers that we had kept on in case we ever had to call them back, they will be terminated effective June 30th. They are aware of that. They've been told, they've received their paperwork, and then they knew that was going to be coming if they weren't going to be needed. But with the changes that the state made with contact tracing as a whole and what the expectations were, we are not going to need to call that staff back up. We do still have that COVID project director / team lead who is also working other communicable diseases right now as well. And so she and any of our permanent health department staff in different divisions are the ones that are handling anything related to COVID right now that can't come up. There haven't been any changes to reporting, and so that's really all I have for COVID unless anybody has any questions.
Okay, Board of Health and Administrator Authority.
Okay, this is something that in our board calendar that we go over in June. It looks like this one is right after your bylaws. It just basically outlines kind of what falls under Board of Health responsibility versus what falls under administrator authority. So I won't sit here and read that to you unless you want to go over anything specific. I'm happy to answer as I can. For our new board members, I can't remember if I put this in my email to you, but Bethany that introduced herself this evening, she is our assistant administrator. So if I was ever out unexpectedly or anything, you can, talk to her or work with her on anything that you would with me. She's privy to everything that's going on, and anything that would be confidential, that would be included as well. Or if there's some emergency and I can't be here, she would be here with you. Does anybody have any questions on that document? That's all I have for that, Mark.
Okay, email address, best practices.
Okay, so I touched on this a little bit last month and promised you we would give you more. If you remember, when you first got your Board of Health email, you got your credentials and some information that looked like this. And for our new board members, they did get theirs this evening, so they'll be getting signed up for theirs as well. So that's just some information about getting your email set up and first use for our new support and who you would reach out to here if you needed some assistance. What we added more detail on was the best practices section. And again, I'll just highlight a few things in there, but please make sure that you review all of that in your time. But all of our information is subject to FOIA. And as a reminder, what we talked about last month with violations of Open Meetings Act, if you're emailing or having conversations back and forth with the entire board. So just be aware of that and make sure if you have not done the Open Meetings Act training or you did it a long time ago, you can review that just to make sure that you are following that as closely as possible. And then there's some tips in here about using different passwords for each account. Don't open attachments if you don't know who they are from. Use antivirus software on your local machine, so on your own computer there at home. It also talks about checking to see if a URL or website is legitimate or not. Don't give your email address to sites you don't trust. It talks about spam emails and how to deal with those. Recommends not sending personal information in those email addresses. Don't reply to spam. Don't share your password. I know we also talked last month about we do send out confidential information, so not allowing others access to your email just as a best practice. And then make sure that you log out when you are getting off of a machine, especially if it's one that is in a shared space. So that's all that was. Does anybody have any questions about any of that? Okay, that's all I have for that. Thank you.
Okay. Presentation and acceptance of financial report.
Turn this on, just be loud.
Just be loud.
Turn on so it'll record you for the minute. There's a little gray button on the side. Do you see it? It's like a little rectangle. It doesn't light up.
Does it light up? Okay, well, we'll hope it's on. Okay.
You're good.
All right, the report is in your packet and it is through the end of May. As of the end of May, we were 50% into our fiscal year. So the ending fund balance was at 7.2 million. Total revenue was at 4.1 million, which is 60% into our budgeted revenue. And total expenditures at 3.2 million, which is 46% into budgeted expenditures. Questions?
Nope. Anybody? Okay. Make a motion to approve that.
No move. Second.
Roll call.
Mark Scranton,
Yes.
Jan Hack,
Yes.
Kenny Coventer, Jeff Entler,
Yes.
Debbie Hill,
Yes.
Dr. Jerger,
Yes.
Dr. Menegatti,
Yes.
Dr. Snyder,
Yes.
Carolyn Wagner.
Yes.
Can I, who was the second one? Second. Thank you.
Okay, review and approval of department expenditures. Anybody have any questions for Andy on this? Not, I'll entertain a motion to approve.
Motion to
approve the expenditures.
Second. Roll call, please.
Mark Scranton,
Yes.
Jan Hack. Andy Clevenger. Jeff Entler,
Yes.
Debbie Hill.
Yes.
Dr. Durger,
Yes.
Dr. Menegatti,
Yes.
Dr. Snyder,
Yes.
Carolyn Wagner.
Yes.
Okay, grant applications for review and approval. First one is the coordinated point of entry, senior information.
So for this one, and to give our new members a little bit of background, the grant applications for review section in our board meeting is usually used for new grants that we've never applied to before. The reason this was implemented many years ago was to ensure that the board did have basically a system of checks and balances to ensure that the things that were being applied for were appropriate for our organization, were not duplication of what someone else in the community was already doing or could maybe implement more realistically, and that didn't require funds that the board didn't necessarily want to commit the health department to. So you won't see things in here all the time that we are applying for. We have many grants that are just like a routine every year kind of thing. And these two particular grants tonight in this section are not new grants. So these are kind of unique tonight. The reason they are in this section is because each year that we apply to have these extended for the next fiscal year, we do have to have it in our minutes that our board approved it. And then for one of them, we do have to have the president do an electronic signature to apply for the grant. And so these are not new, these are things we've been doing for years and years through Starting Point. But that is why you're seeing them in that section tonight, so that we can have documentation of your approval and then your support for Mark as president to sign this evening at the end of the meeting. And I do have, Janelle is here tonight. She's the Assistant Director of Starting Point, if you have any specific questions about either program.
Okay, do we want to approve this or do we want to go to the caregiver advisory services? Is that something we're going to make a vote on? Approve?
Yeah, motion and a vote for both of them.
Okay, so maybe want to do them collectively or separately?
If we could do them separately, just to be
Okay.
safe for the.
So I'll have a motion to approve these grants as presented. Motion Carolyn, second. Dan. Roll call,
Mark Scranton,
yes.
Jan Hack.
Yes.
Andy Clevenger.
Yes.
Jeff Entler.
Yes.
Debbie Hill.
Yes.
Dr. Durger,
Yes.
Dr. Menegatti,
Yes.
Dr. Snyder,
Yes.
Carolyn Wagner.
Yes.
Okay, next item is the caregiver advisory services.
That's the same situation with
Okay,
the
those are
other
both
one,
the
yep.
same, okay,
This is
all
something
right.
we do every year, yep.
Okay, motion for that. Carolyn, second. Dr. Schneider, did you second?
Yes.
Okay, roll call,
Mark Scranton,
yes.
Jan Hack.
Yes.
Andy Clevenger.
Yes.
Jeff Entler.
Yes.
Debbie Hill.
Yes.
Dr. Durger,
Yes.
Dr. Menegatti,
Yes.
Dr. Snyder,
Yes.
Carolyn Wagner.
Yes.
Department division reports, these are in your packet. If anybody has any questions on anything specific related to a specific department, staff is here to answer those questions. I have one comment that I was gonna bring up last month's meeting and didn't do it because we were dealing with some other things that kind of slipped my mind. On the environmental health division, on the report where you guys are showing documentation on your, I'll show you this, Brian, where you guys do documentation on your activities as far as your inspections and stuff goes. Up until last month, you guys had this broken down by staff, who was doing what, and for some reason now it's been omitted. And I would like to know why, but I'd also like to request that that be included back in this reporting again, because it gave us a real good guidance of what everybody in that department is doing as far as their activities go.
Okay. I don't know if we lump them all together again just to go make it simpler and show totals, or what the reason was, but we can break it out by staff.
Okay, because last month was the first time I seen it not included, and now I see it again this way this month, so that's something I wanted to bring to your attention. Anybody have anything else on division reports? Okay.
Well, Mark, can I interject? While you're on environmental health, I did want to just let you all know that Mike Baggett and I talked this afternoon about some different things he's reviewing for us. And one of those is the digital environmental health software, basically, that we've been working on trying to get for quite some time. And he has helped us work with the company back and forth about getting some edits made to the contracts. So I do expect here, hopefully by the end of this week, to go ahead and send you those contracts so that you can start looking at them. And if you have any questions or anything, that we can hopefully approve next month if possible. But I want you to have enough time. And we just chatted later this afternoon, so I wasn't able to get it all together for you before this meeting. But we do have it all in email. So I'll get all of that sent to you, and then you're more than welcome to ask any questions, and Mike is very familiar with it, so if there are legal questions to be presented, he would be able to answer.
So you've got it pinpointed down to one company now?
Yeah, we have it down to one company, we have numbers, we have, they've made some edits to the contract that Mike has requested to make it what it needs to be in order for us to sign, if we are given permission to sign. So we're hoping that we'll be able to move forward with it.
Have you guys tried this out? What's your thoughts on it? Are you happy with what you're looking at?
Kathy has looked at it extensively. She's reported to us as she's met with vendors. Other experiences we have with other departments who use different software. This is superior from all our reports so far that we've interacted with.
So have you guys had conversations with other health departments around or wherever they're at that have used this and got feedback from them?
I haven't had any conversations with others that have used this. I've had the conversations with others that are using different software. And what we can see, this is a major improvement over what is out there in our neighboring counties.
Any long-term cost considerations once we get past the initial?
There would be ongoing costs, and I will bring that to you all as well, because there is like the ongoing licensing costs and all of that after that initial implementation
But
cost.
you guys are comfortable with what you're seeing?
It would be something, it would be something that, of course, the board would have to approve to come out essentially of the health fund. That reserve that we have, that we talked about last year. So that would be something that you all would have to approve. We wouldn't just do it. It would be the board, but I could definitely bring that. You would be able to see what the ongoing cost is going to be for the upcoming years. Any support costs, if we had to have any kind of support from the company outside of just what our IT could do, any of that type of cost, and the best estimates that we could come up with. So I will make sure you have all of that. And I know that Kathy has, and Brian, they've talked to the surrounding health departments about all of the available programs out there. From my knowledge, and I'm going off of memory here, but I believe there's just larger organizations, not small local health departments, that have used this specific program. But she did speak with them, so she did have information from those specifically. And part of it is done, it's basically two separate agreements, but part of it is Salesforce, which is the program that we've used through contact tracing that the state used. But we basically chose them as our top contender before we ever used it for contact tracing. But we were able to use it in a user-friendly way for contact tracing. So I'll send you all of that, and then you'll have time, for any follow-up questions for me, Mike, Kathy, and Brian, before you would be asked to vote or anything. But I was excited that we can basically move to the next step now. I wanted to let you know that.
Okay, just in the light of the rest of the board, I brought this up to Brandy and Kathy both last year, like June, July, I think we talked about this. And this is something that I felt really strongly about, that the people in that division really needed these tools, because this will allow them to go out and operate more efficiently when they're out doing inspections. They're going to be able to have data. I don't know how detailed the software gets into, but say like, Debbie goes out and does inspection, and then there's got to be a follow-up inspection, and she can't be around or whatever. Brian's got to go do the follow-up, and Brian doesn't necessarily maybe have all the paper notes or whatever on a particular situation. That documentation is all going to be available to them electronically, and not only that, they're going to be able to get their reports done more efficiently and more effectively. They can look at historical information on a particular thing. So it's something I advocated for early on because I've known some of the staff for a long time, and I've seen some of the struggles they've gone through trying to do things in the 19th century mode. So it was like time to kind of come into the new technology, considering everything else is being done that way. That's something I felt pretty strongly about would make the department not only more efficient, but keep better records. So I'm really excited to hear that you guys have finally crossed that path, because I know it's taken a while. So thank you for that. Dental clinic.
We have Dr. Kim here this evening, and he will be doing the brief mini presentation on the dental clinic. And for our new board members, we started just a few months ago or so bringing a specific division director each month just to do a short, max 10-minute presentation, just to give you an idea about what they do in their department and give you the opportunity to meet them and ask any questions that you might have of them. So Dr. Kim, if you want to come up.
Good evening, I'm Dr. Kim, I'm the Director of the Dental Division. I started this position last September. And I've been dentist for 7 years. I studied at Buffalo in New York State, and I moved to Champaign for my job. But previously I was a mechanical engineer back in South Korea, where I'm from. This is my brief background. Let me present our dental clinic. We have a full-time dentist, which is me, and a part-time dentist, and a manager and a receptionist, and we have 2 dental assistants. And we are trying to hire a 3rd dental assistant too. And we utilize 4 dental chairs for services, and we have a digital X-ray and panoramic X-ray machine. And we updated our dental software in February. We switched from EagleSoft to Fuse, and Fuse is a cloud-based software, so we can access outside the clinic in case building shut down on snow days. And we launched Revenue Wall this month. This is an online paperwork program. So you can send text message or email link to patient. The patient can fill out their paperwork even before they come to clinic. But the patient compliance is some issue because this is new, but it's going to be getting better. And also we are thinking of trying to use tablet clinic for paperwork. So we're moving toward running our office without paper. And we provide a full service for patient under age 20 years old. Mostly our patient is young kid under 12 years old. We provide preventive services such as exam, hearing, fluoride, and surveillance. And we provide restorative services, filling, and crown. We do emergency exam for prescribed antibiotics and extractions. For adults, we provide emergency services, mostly extraction. And we see patients who are on the Medicaid insurance, and patients should be Macon County resident. We also provide reduced fee schedule for patients who don't have insurance. And we schedule about 20 to 24 patients per day, and we usually see around 15 patients. And our daily production is around $3,000 a day. This is all I have today.
Okay, thank you, Dr. Kim. Anybody have any questions? Thank you.
Thank you, Dr.
Thank you.
Okay, employee recognition. You'll have in your packet, you see some anniversaries for the month of June. And I'd like to thank those employees for their continued service. Closed session, Brandy, do we have anything for closed session at all?
We do, yes.
We do?
Yes.
Okay. So I'd like to entertain a motion to go in closed session.
Mr. President, we'll need to cite the statutory citation for the record has to be done in open meeting. So I think this is pursuant to section 2C21 or 29 of the Open Meetings Act in order to review